Hi there, my name is Jennifer Dayton, author of the book 7 Secrets of Horsemanship and Understanding Horses. I want to welcome you to this video on brain health for riders. I recently started learning about this stuff, and it's amazing the technology that's available, the things that we've learned in neuroscience and about the brain. And us as riders, most of us have fallen off at one time or another and banged our heads. We've even just handling the horses gotten a cuff to the head at times, and what we don't realize that even with a helmet we can have injuries that may not show up as injuries the way we think that they do, and that was what was so amazing to me. So this video teaches you a little bit about what I've learned and gives you some tools and references to go further if you think that you are maybe affected or know somebody that is. I think it's important to get the word out, so please feel free to share this video with whomever you would like, whether they're riders or whether they're not. If they're sports enthusiasts, it can be relevant. So I hope you enjoy it, and I look forward to hearing back from you. Please comment on the blog post too. Thanks.
Welcome to this short video on riding and brain health. These are things you need to know as a horse enthusiast about head injuries. As horse lovers, most of us are not willing to give up riding, and although we are getting better and better as an industry at protecting our heads with the use of quality helmets, we need to realize we are part of a high-risk category. Did you know that of all sports, horseback riding resulted in 11.7% of all traumatic brain injuries in recreational sports? This is the highest percentage of any athletic activity. There are more alarming statistics than that. Riding makes the top 20 list of sports that cause traumatic brain injuries. Across emergency rooms in the U.S. in 2009, there were an estimated 14,446 horseback-related head injuries. 3,798 were serious enough to require hospitalization. 5,000 were assessed as concussions, approximately a third of the 14,446, and there were 97 skull fractures. 60% of deaths resulting from injuries with horses are due to head trauma. The use of helmets can reduce the risk of head and brain injury by 85%, but brain injury can occur even while wearing a helmet. The human brain is the consistency of tofu or custard or soft butter. It is housed in a hard skull with bony ridges that are very sharp. So even when we bump our heads, our brains can actually hit the inside of our skull and have dents and other visible trauma that would show up in a brain scan. Depending on where the trauma is, this will influence the symptoms that might be present. For example, bump on the head that affects the prefrontal cortex, which we will learn in a minute is at the front of the brain, might cause problems with depression, distractibility, impulse control, the ability to feel and express emotions, empathy, and other things. Science has proven that we can actually generate new brain cells, which is absolutely remarkable. And we can improve the health of our brain and have a better life because of it. We have more brain cells in our brains than there are stars in the Milky Way. When we don't take care of our brains, we can lose 85,000 brain cells per day. In looking for healthy brains to assess, the Amen clinics, which specialize in SPECT scan brain images, had to scan 3,000 brains to find just 90 healthy ones. What this means is having a quote-unquote normal brain does not mean necessarily having a healthy one. Most of us have areas of our brains that we can improve or heal. As riders, we are at high risk for head trauma, even if it's just from a horse whacking his head against yours. We may not be aware the extent of the insult to our brain, and if we find ourselves chronically stressed, depressed, lacking in focus, willpower, or a host of other attributes, this can actually be explained by an unhealthy brain. Brain injuries can show up in your life as depression, anxiety, fear, anger, lack of motivation, lack of concentration and ability to focus, poor judgment, uncooperativeness, appetite and sleep problems, problems with libido, problems with learning, memory, and understanding, emotional stability, disorganization, problems with fine or gross motor skills. So let's go through a crash course on brain anatomy. This is by no means comprehensive, and we are looking at merely 6 parts of the most complex thing in the universe. The first part of the brain we will talk about is the part that was mentioned before, the prefrontal cortex. It is located in the front third of the brain, underneath the forehead, and is the most evolved part of the brain. It is responsible for attention span and focus, judgment, impulse control, empathy, problem solving, and the ability to feel and express emotions. Overall, it is the part of the brain that controls your behavior. Problems with the prefrontal cortex can show up as having a short attention span, being very distractible, disorganized, and generally having poor judgment. It can also show up as the person having unavailable emotions, being disengaged, procrastinating, being anxious, and having misperceptions of the truth. Because it is connected with the limbic system, which we'll talk about soon, problems can also appear as difficulty with mood control. Moving on, let's look at the anterior cingulate gyrus. The second brain system is that of the cingulate. It is located transversely along the central deep aspects of the frontal lobes. It is the gear shifter of the brain. It is responsible for the ability to shift attention, to adapt to new situations and techniques, the ability to cooperate, to see alternatives, to move from idea to idea. In short, it is responsible for cognitive flexibility, or the ability to adapt to and learn new methods and techniques. Problems with the cingulate system can show up as worrying, getting stuck on certain ideas, or obsessing over things. It can also look like compulsive or oppositional behavior. People with cingulate issues often argue with everything. Therefore, problems with this brain system can show up as argumentative personalities and uncooperativeness. Addictive behaviors often result from problems with the cingulate system. Moving on to the deep limbic system. The deep limbic system is the third brain system of 6. It is located near the center of the brain. This system is responsible for our libido, our sense of smell, our appetite and sleep cycles, and our motivation. It's what sets the emotional tone of the mind, stores emotions with a lot of feel and energy behind them, and promotes bonding with others. It's responsible for much of human behavior and survival, and it's about the size of a walnut. Problems with the deep limbic system can look like moodiness, irritability, increased negative thinking, and decreased motivation. Problems can also cause people that are affected to have a negative perceptions of things that occur and a flood of negative emotions. When the deep limbic system is not working right, the person affected can have appetite and sleep problems, become socially isolated, and have a change in sexual responsiveness. The fourth brain system is the basal ganglia system, a set of large structures near the center of the brain that are on either side of the deep limbic system. This area of the brain is responsible for integrating feeling and movement, smoothing out fine motor control, and it enhances motivation. It also sets the anxiety level of the body and mediates both pleasure and ecstasy. If the basal ganglia is not working right, or if they're not working right, there can be problems with anxiety or nervousness, and and a tendency to think the worst is about to happen. Panic attacks, headaches, and avoidance of conflicts are also symptoms. Additionally, low or excessive motivation and fine motor problems can be symptoms of a less than healthy basal ganglia system. The temporal lobes, located on either side of the brain, behind the eyes and below the temples, make the fifth brain system to be described. There is a dominant side, which is usually the left, and a non-dominant side. The left side is responsible for understanding language, auditory learning, emotional stability, retrieval of words, long and immediate term memory, and complex memories. It is also responsible for visual and auditory processing. The right side is responsible for visual learning, music and rhythm, recognizing facial expressions, and decoding vocal intonation. If there are problems with the temporal lobes, they can show up as aggression, emotional instability, reading difficulties, and other language problems such as finding the right word, sensitivity to light, mild paranoia, memory problems, headaches or abdominal pain, anxiety or fear, seizures, and abnormal sensory perceptions. There can be problems in interpreting facial expressions of others and understanding social cues, particularly in tone and voice. The final brain system mentioned here is the cerebellum. This is located at the base of the brain, just above the brain stem where the spinal cord attaches. This area is responsible for locomotion, including posture, gait, and motor control. It connects to the prefrontal cortex to have executive function, and it is also responsible for organization. So problems with the cerebellum show up as impulsivity, slower thinking and speech, poor learning, disorganization, and coordination issues. So now let's look briefly at a couple case studies. There are many examples of amazing stories about how relevant this information is in the book Change Your Brain, Change Your Life by Dr. Daniel Amen. I'm going to read two excerpts from two different case studies, the first one being a woman named Karen. This is on page 234 of the book, and I'm just going to read directly. Karen, 48, had waged a 20-year battle with alcohol abuse. She had gone through 3 marriages, 5 alcohol treatment programs, and multiple medications. She complained of feeling tired, depressed, and angry. Without the alcohol, she didn't feel right. In addition, she had a terrible problem with impulsivity. Whenever she was placed on a new medication, her doctor would give her enough of it for only 2 or 3 days at a time. Otherwise, she would take the whole month's worth of medication, no matter what it was for, within a few days. Surprisingly, no one had ever examined her brain to see if it held any keys to why Karen was so resistant to treatment. Her doctor, after hearing one of my lectures, sent her to see me for a scan. It showed overall decreased activity consistent with the alcohol abuse, but it also showed markedly decreased activity in the prefrontal cortex. The part of her brain that controlled impulses was damaged. On my intake form, she reported that she'd never had a head injury. I knew that many alcoholics during blackouts have head injuries they are not aware of. I asked her doctor to check further into her history for head injuries. When he asked her to check with her mother remembered a time when Karen had been kicked in the head by a horse at age 7 and had been unconscious for about 10 minutes. The second case study I thought was worthy of note here was that of Willie. This is featured on page 33 to 35 of Change Your Brain, Change Your Life. Willie was the kind of guy who got along with everyone. An A student, he had a college scholarship waiting for him, and his future seemed altogether promising until his head collided with the dashboard when his car accidentally hit a guardrail rail. Although Willie felt dazed, he seemed to be okay by the next day. 3 months later, he got into another accident where he swerved to avoid hitting a dog that had run into the street. His head hit the windshield very hard, and this time he had to be sent to an emergency room. After examining Willie, the doctor told him he had nothing to worry about. He had only a minor concussion. In the months that followed, however, Willie found that the minor concussion was wreaking havoc with his life. Normally a friendly person, he found himself losing his temper at the smallest things. His whole attitude and demeanor began to change. Where he had once been patient, he had now had a short fuse. Where he had once been amiable and calm, he was now always angry. His irritability and constant flares of temper began to alienate his friends and family. The brunt of his anger came to rest on his college roommate and strangely began to center around food. Inexplicably, Willie's appetite was changing. In just 3 months, he had put on 70 pounds and he was hungry all the time. He seemed to be devouring every morsel of food in the house. When his roommate finally got fed up with Willie eating all the groceries and asked Willie to eat only the food he bought himself, Willie felt that by depriving him of the food needed, his roommate was trying to hurt him. Willie was consumed with negative, paranoid thoughts about this person who was, quote-unquote, trying to take the food out of his mouth. In his mind, the only way to protect himself against this enemy was to hurt the enemy. One afternoon, he took a huge meat cleaver and a butcher knife and waited at the front door for the man who used to be his friend. He was going to be instantly dissolved, Willie later told me. Yet even as he was gripped by paranoia, some part of Willie's mind was still sane. He saw himself, as if from above, standing behind the door and holding these weapons. He knew he was out of control and that he had to stop himself before it was too late. He went to the telephone and called a friend, who gave him my telephone number, and the immediate crisis was averted. Willie described for me his 2 accidents and the severity of his personality changes. I immediately ordered a brain study. As I expected, the study showed abnormalities. 2 areas were working too hard. One was in his left temporal lobe, where dysfunction is often associated with paranoia and violence, and the second was the top middle section of the frontal lobes, the cingulate area. Again, the part of the brain that allows a person to shift attention freely from one thing to another. When this part of the brain is overactive, people get stuck in thought spirals. The minute I saw Willie's brain study, it clearly explained for me the changes that had been occurring in his personality: paranoia, fiery temper, and negative thoughts about his roommate, which he couldn't turn off. The next step was clear. And he was prescribed an anti-seizure medication for the temporal lobe abnormality and an anti-obsessive antidepressant to help him get unstuck from negative thoughts. After several weeks of treatment, the results were dramatic. Willie began to regain his sense of humor and to reconnect with his family and friends, and at the time of this writing, it has been 6 years since his 2 accidents. Now on medication to control the trauma-induced brain problems, he's one of the nicest human beings you will ever meet. By now you've had a glimpse at some of the unbelievable effects that not taking care of our brains can have on our lives. Now let's look at some of the tactical things that we can do to improve not only the health of our brain, but our health overall. First, we want to eat from the rainbow, and I know we are told that by almost any health expert, but this is something that we really need to be better at. We need to eat fresh, whole foods, and we want to make sure that we're incorporating brain smart foods, and these are foods that are particularly nourishing to the brain. Now, Dr. Amen's wife, Tana Amen, she's a registered nurse and nutritionist, and she's developed a bunch of recipes which you can get online at www.tanaamen.com/recipes. Really, really good stuff. I've tried a bunch of her recipes right now. Really good food. 12 great brain foods that you can eat are avocados, blueberries, broccoli, green tea, oatmeal, oranges, red bell peppers, salmon, spinach, tuna, walnuts, and turkey. Second, we want to make sure that we take a quality multivitamin every day, and that we should take fish oil supplements from a wild source of fish, as well as vitamin D and vitamin C. Third, we want to make sure that we're getting enough sleep. Ideally that we wake up on our own, but at a bare minimum that we get 6 to 8 hours of sleep per night. if you get less than 6 hours of sleep, you are actually losing brain cells. Fourth, we need to keep thinking positive thoughts. As part of that, we really should, for many reasons, acknowledge every day 5 new things that we're grateful for. Gratitude stimulates blood flow to the hippocampus, a memory center in the brain. Fifth, we need to exercise at least 4 times per week, even if it's just a brisk walk outside. There's not an area of your brain which wouldn't benefit from some good exercise. Exercise helps the growth center in the brain that helps you grow new neurons. And exercise is truly the fountain of youth. If you want to look younger, exercise more. Sixth, we should embrace lifelong learning. The adage, if you don't use it, you lose it, holds true. Keep learning new things and engaging your brain in stimulating activities, like language learning. Anything that coordinates something intuitive with something coordinated hand-eye motion, such as table tennis, is also really good. Seventh, we should practice meditation. It has been proven to stimulate blood flow to the brain and activate the brain's natural healing mechanisms. If you're like me and have tried meditation and really just can't shut off the thoughts, it takes some practice, it takes some time, and it does get better. And really, you can find a lot of other benefits of meditation besides stimulating the healing mechanisms of your brain. Lastly, we should get our brains scanned, or at a minimum, take the questionnaire put out by Dr. Amen and the Amen clinics. This questionnaire helps identify the areas of the brain that could be functioning at a higher capacity. I would encourage you to go further than the questionnaire. You can join my BrainFit Life, an on-site membership site, an online membership site, to facilitate brain healthy habits into your life. With the information you gain from the questionnaire, it is important to know what you can do to improve the areas of your brain that you identify. So, reading through Change Your Brain, Change Your Life by Dr. Amen gives you tactics for healing the different areas of the brain, more case studies so you can recognize how encompassing the area can be throughout your life, and he even suggests specific exercises or supplements to take. This is important. To learn more about all of this and to hear him speak, watch his PBS special. You can see it online for free at publictv.amenclinics.com/change your brain, change your life / with that, you can kind of click around and find specials on ADD, Change Your Brain, Change Your Body, and Unleashing the Power of the Female Brain. It's amazing stuff. The resources listed in the last slide also have must-know information for anyone that is or knows someone that is suffering from attention deficit disorder or depression, addictions, and much more. To get a complimentary copy of the questionnaire, all you need to do is fill in the form below so we know where to send it. And if you have any trouble with the form, you can always send me an email to goldcircleequine@gmail.com. goldcircleequine@gmail.com. You shouldn't have trouble with the form, but if you do, send an email there and just ask for one, and I'll be happy to get one out to you. Thank you.
So hi again, I hope you enjoyed that video. It was, to me, such a wow eye-opener that maybe a lot of the reasons that we are, many of us suffer from depression, or we have difficulty interacting with others, and different things that are common in the industry. I know part of it is just that we overwork ourselves and we're not the best version of ourselves a lot. But I think a lot of this could be relevant as well, and I think it's stuff that I had no idea about, and I'm sure I wasn't the only one. You know, I talk a little bit in the blog post about I've banged the front of my head a lot. One of the areas that I tested when I did the questionnaire was the prefrontal cortex, and I've been doing an audio program where you listen to it and it takes you into a deep meditative state, which is something I've never been able to do, is meditate. I just can't shut it off, right? And so it helps guide you through. And even though my mind still wanders and it's still racing and it's starting to come back, and I already see an improvement after just a month of doing this CD, which it's meant to stimulate blood flow to the prefrontal cortex and that front area of your brain and improve your ability to focus and to remember. So it's just amazing stuff that we can heal our brains and make them better than what they are. So I hope you've enjoyed this. Please download or fill out the form and get the questionnaire. I'm happy to send that to you. And go and watch some of the videos on the PBS special Dr. Amen has, or you know, buy the book, Change Your Brain, Change Your Life. There's other stuff like Unleashing the Power of the Female Brain. Fascinating stuff. And I encourage you all to you know, honor yourself and take care of that part of you. And you will see a difference in your life.